There's a growing movement of social media influencers promoting raw or unpasteurized milk. It's coincided with a recent spike in sales across the country, with more than half of U.S. states giving farmers the power to sell raw milk direct to consumers. It is good for business, but health officials say the consequences could be dangerous. Chanel Call has more.
On this dairy farm in Harrington, Delaware,
we take a clean towel off of the T ends.
Stephanie Knutson is busy milking her cows.
So the cows are milked twice a day.
This milk gets pasteurized and sold at grocery stores across the country.
We're milking her into this bucket milker down here.
But come January, Knutson hopes to sell it raw.
We have always drank raw milk and that we produce on the farm. I'm a big proponent of this being regulated. People are having a hard time.
And regulation could soon be coming as Delaware considers legalizing the sale of raw milk amid a recent and growing movement online.
I drink raw cream in my coffee every morning. Raw farm dairy.
If I'm going to do milk, it's going to be raw milk that I get at the farmer's market.
Celebrities, influencers, even some politicians are endorsing raw milk that has not been pasteurized or boiled to kill dangerous germs. So we asked CBS News medical contributor Dr. Celine Gounder to weigh in.
There is no nutritional benefit from drinking raw milk. People like the idea of it. Maybe they think it tastes better. Maybe they think it's, quote, more natural. But it's really no more natural than drinking water that has not been treated.
And all that bacteria can lead to health problems.
E. coli, Campylobacter, Salmonella. These can give you fever, abdominal pain, diarrhea, kidney failure. Listeria can cause fetal abnormalities, even fetal death.
This year, doctors found high concentrations of the bird flu virus in the raw milk of infected dairy cattle. And a salmonella outbreak linked to raw milk sickened 170 people on the West Coast. So why is raw milk's popularity and access still growing?
I think this goes back to people's lack of trust in public health and wanting to feel like they can make healthy choices for themselves. Unfortunately, in this case, that is not the healthy choice.
The CDC, the American Academy of Pediatrics, and the American Medical Association all agree. But in a bid to help struggling dairy farmers,
it's been very difficult to operate on the positive side of things for 20-some years now.
More than half of U.S. states created a pathway for raw milk to be sold directly to consumers within state lines.
With raw milk, we can set the price, and the national average price for raw milk is $10 to $14 a gallon. From our co-op, we might be getting $1.50 a gallon.
Though without federal oversight, the standards are inconsistent.
States have been left to come up with their own rules. They are really, literally all over the place, from pretty much incidental sales being totally unregulated and all you have to do is put a warning label on it to say it's unpasteurized, to other states that require a lot more high-level testing.
While doctors still warn against consumption, farmers like the Knutsons see an opportunity to meet this growing milk market.
It can absolutely help us to thrive, not just survive.
For CBS Saturday Morning, I'm Chanel Call.
I think it's interesting because people do want to do the healthiest thing, and there was a lot of information in there I was not aware of, so I'm glad to have learned some of that.
And I think the farmers trying to make more money. As she says, we want to thrive, not just survive. But there's a lot of factors, I guess, at play.
Yeah.